Okay, so are you ready? Get ready to decode the itch. Because today we're diving into the surprisingly complex world of vulvar itching.
Oh, yeah. Now,
This is a good one.
you might be experiencing this yourself, prepping for a doctor's appointment or just curious about the science behind it. And trust me, there's a
Yeah,
lot more to it than you might think.
it's true.
We've got two sources to guide us today.
Okay.
Excerpts from a medical resource designed for patients
Mm-hmm.
and a quick facts guide for a more general audience. And what's fascinating is that the causes can be anything from everyday irritants to,
Oh, yeah.
well, let's just say some unexpected things.
Yeah, that's what makes this deep dive so interesting. It's a symptom most people experience at some point, but the causes are incredibly diverse. So many
Yes.
things.
So instead of starting with a basic definition of vulvar itching, let's jump right into the nitty-gritty.
Okay, let's do it.
Our sources mention that burning, stinging, even rawness can accompany the itch.
Oh, yeah. It's not just an itch, it's a whole symphony of discomfort, right?
Absolutely. And those additional sensations, along with any redness, are key clues for doctors.
Okay.
They help paint a clearer picture and guide them towards the right diagnosis. Think of it like a puzzle.
Yeah.
Each symptom is a piece that helps complete the picture.
Okay, so let's start putting those puzzle pieces together. What are some of the usual suspects behind this symphony of discomfort?
Well, first we have the everyday culprits.
Okay.
Things like soap, lotions, laundry detergent, anything that comes into contact with that delicate skin can be irritating.
Right.
Even products designed for sensitive skin can sometimes trigger a reaction.
Right, so sometimes it's those seemingly harmless everyday things
Totally.
that are causing the problem. But it's not always an external factor, is it?
No, sometimes the culprit is internal. Both sources highlight infections, both vaginal and vulvar, as common causes. You mentioned yeast infections earlier, which are incredibly common. But the Quick Facts Guide also mentions something called abnormal discharge.
Here's where it gets really interesting. The discharge itself can offer clues about the type of infection.
Precisely. The color, consistency, and even the smell can be indicators.
Oh.
For example, a thick white discharge is often associated with yeast infections, while a thin grayish discharge with a fishy odor might point to bacterial vaginosis.
Okay.
And then there are sexually transmitted infections, or STIs,
Right.
which can also cause discharge and itching.
So we've got irritation from external factors and we've got infections. What else is on the list of potential culprits?
Both sources mention a skin condition called lichen sclerosis.
Lichen sclerosis.
It's a chronic inflammatory condition that primarily affects the genital and anal areas. What's interesting here is that it can cause thinning of the skin, leading to those feelings of rawness and burning that you mentioned earlier.
So if you're experiencing that intense rawness,
Yeah.
lichen sclerosis could be a possibility. Now, before we move on to the next potential cause, I have to ask, what about pubic lice?
Oh, yeah.
The sources briefly mention them, but not much else.
Right. Pubic lice, also named as craps.
Right.
While they are less common than some of the other causes we've discussed, they can certainly cause significant itching and discomfort. And it's important to remember that they are highly contagious and require specific treatment to get rid of them.
Okay, good to know. So we've covered irritation, infections, a skin condition, and even tiny bugs. Anything else we should be aware of?
One more thing, allergies. Just like other parts of your body, your vulvar skin can react to allergens,
Wow.
leading to itching and irritation. It could be anything from a new laundry detergent to certain types of feminine hygiene products.
Wow. So the list of potential culprits is quite extensive.
Yeah.
It really highlights the complexity of this seemingly simple symptom, doesn't it? But with so many possibilities, how do you know when it's time to actually see a doctor?
That's the million-dollar question, isn't it? And both of our sources are very clear on this. If you're experiencing vulvar itching,
Yeah.
especially if it's persistent or accompanied by other symptoms,
Right.
a doctor's visit is essential.
It's like they're saying, don't mess around with this. Go
Yeah.
get it checked out. I think sometimes we try to downplay these things.
Right.
Or convince ourselves it's nothing.
Yeah,
But it's so important to take our health seriously, right?
absolutely. You wouldn't ignore a persistent cough
Right.
or a strange pain.
Yeah.
And vulvar itching is no different. It's your body's way of telling you something's up,
Right.
and it deserves your attention.
Okay, so you've decided to see a doctor. What can you expect during that visit?
Sure.
What happens behind the scenes, so to speak?
Well, the first step is usually a conversation. Your doctor will want to gather as much information as possible about your symptoms.
Okay.
When did the itching start? How intense is it? Are there any other symptoms like discharge or pain? Have you noticed any potential triggers?
So it's like a detective story,
Yeah,
with the doctor gathering clues to solve the mystery of the itch.
exactly.
But talking isn't the only tool in their arsenal, is it?
Right, a pelvic exam is often part of the process.
Okay.
This allows the doctor to visually assess the vulva and vagina, looking for any signs of irritation, infection, or other abnormalities.
So they're looking for anything out of the ordinary,
Yeah.
anything that might point to the underlying cause. And what about those tests we mentioned earlier?
Yeah.
Like fluid samples, patch tests, and biopsies. When do those come into play?
Those tests are often used to confirm or rule out specific causes.
Okay.
For example, if there's discharge present, the doctor will likely take a sample
Okay.
to test for various infections like those we discussed earlier.
Right, because as we learned, the type of discharge can offer clues about the type of infection. So it's like connecting the dots between symptoms, visual examination, and lab results
Yes.
to get a complete picture.
Exactly. It's a multifaceted approach to ensure the right diagnosis and ultimately the most effective treatment.
Okay.
Now, patch tests are typically used to identify allergies.
Mm-hmm.
Small amounts of different allergens are applied to the skin,
Right.
usually on your back,
Ah.
and then monitored for any reactions.
Interesting. So if the doctor suspects the itching might be caused by an allergic reaction,
Right.
they have a way to pinpoint the specific culprit. What about biopsies? When would those be necessary?
Biopsies are less common and are usually reserved for cases where other tests haven't provided a clear answer,
Okay.
or if there are concerns about more serious conditions like certain skin disorders.
So it's a more invasive procedure, but sometimes it's necessary to get to the bottom of things. Okay, so we've talked about symptoms, doctor visits, and tests. It's all started to come together, but the big question is, what about treatment?
Yes.
How do we get rid of this pesky itch?
The good news is there's a whole arsenal of treatment options available, but the key is identifying the underlying cause. As our sources emphasize,
Right.
there's no one-size-fits-all solution. The treatment will be tailored to the specific culprit.
That makes sense. You wouldn't treat an infection the same way you treat an allergic reaction.
Right.
So can we break down the treatment options
Sure.
based on the different causes we've discussed?
Absolutely. If the itching is caused by an infection, for example,
Yeah.
the treatment will target that infection.
Hmm.
Antifungal medications for yeast infections,
Right.
antibiotics for bacterial infections,
Okay.
and specific regimens for STIs.
So it's all about fighting the infection to relieve the symptoms.
Yeah.
But what if the cause is something like irritation
Right.
from soaks or laundry detergents?
In those cases, the focus shifts to eliminating the irritant.
Okay.
This could involve switching to gentler, fragrance-free products,
Mm.
avoiding tight-fitting clothing,
Right.
or simply being more mindful of what comes into contact with your vulvar skin.
Okay, so sometimes it's about prevention and making different choices in your daily routine. But what about situations where the itching is severe
Yeah,
and you need immediate relief? Are there medications that can help with that?
absolutely. The source material mentions a variety of medications that can help alleviate itching. These can range from topical creams and ointments applied directly to the affected area to oral medications that work systemically. And for those who experience severe itching at night, there are even medications that can help with sleep while also reducing the itch.
Wow, so there's a whole spectrum of options, from targeting the underlying cause
Right.
to managing the symptoms themselves.
Yeah.
And speaking of options, I remember the sources mentioned a few other interesting treatment details.
Okay.
For instance, what exactly is a sitz bath
Yeah.
and how does it help?
A sitz bath is a warm, shallow bath that you sit in for a short period of time. It can be incredibly soothing for vulvar itching, especially if there's irritation or inflammation. The warm water helps to cleanse the area gently and promotes healing.
Ah, so it's like a spa treatment for your vulva.
Yeah.
And I also remember reading that sometimes sexual partners need treatment too,
Yeah,
especially if the itching is caused by an infection. That makes sense, right?
absolutely. Treating both partners helps to prevent reinfection and ensures a healthy outcome for everyone involved.
So we've covered a lot of ground here. We've explored the various causes of vulvar itching, the importance of seeing a doctor, the diagnostic process, and even a range of treatment options. But you know what they say,
What's up?
an ounce of prevention is worth a pound of cure.
That's right.
So let's shift gears and talk about what we can do to prevent this pesky itch in the first place.
Great point. While not all causes are preventable, there are definitely some simple steps you can incorporate into your daily routine to reduce your risk.
And our sources provide a fantastic list of prevention tips. They emphasize gentle cleansing, breathable fabrics, and perhaps most importantly,
Yes.
ditching the douches.
Well, that's a good one.
Can you elaborate on why these things are so crucial?
Certainly. When it comes to cleansing, less is more.
Though,
The vulva is a self-cleaning area and doesn't need harsh soaps or scented products.
right.
Plain water or a mild unscented cleanser is all you need.
It's like we're trying to overcomplicate things when our bodies are perfectly capable of taking care of themselves, right?
Exactly. And breathable fabrics, especially cotton underwear,
Right.
are essential for allowing air to circulate and reducing moisture buildup,
Uh-huh.
which can create an environment where bacteria and yeast thrive.
So it's all about creating a healthy environment down there. And what about douching?
Oh, yeah.
Why is it such a big no-no?
Douching disrupts the natural balance of bacteria in the vagina, which can actually increase your risk of infections,
Okay.
including yeast infections and bacterial vaginosis.
It's like we're trying to sterilize an area that's meant to have a diverse ecosystem of bacteria.
That's a great analogy. The vagina has its own natural cleaning mechanisms,
Yeah.
and douching interferes with that process.
So gentle cleansing, breathable fabrics, no douching. These are the golden rules for keeping your vulva happy and healthy.
That's right.
And, as we wrap up this section on prevention, I think it's worth emphasizing that being proactive about your vaginal health is about more than just avoiding itching. It's about being informed, making healthy choices, and feeling confident in your own body.
Absolutely. It's about understanding your body and giving it the care it deserves. And that brings us back to one of the key takeaways from both of our sources: the importance of seeking medical advice when you experience vulvar itching.
Like they're both saying, don't try to self-diagnose or tough it out, go see a professional. It can be tempting to Google your symptoms and try to figure it out on your own.
Right.
But with so many potential causes, it's crucial to have a doctor guide you through the process.
Exactly. Doctors have the expertise to accurately diagnose the underlying cause and recommend the most effective treatment. Plus, they can rule out any serious conditions that might be lurking beneath the surface.
It's like having a personalized health detective on your side.
That's right.
And speaking of detectives, those tests we discussed play a crucial role in solving the mystery of the itch.
Absolutely. Fluid samples, patch tests, biopsies. They each provide valuable pieces of the puzzle, helping to pinpoint the specific culprit behind your discomfort.
It's amazing how they can zoom in on different aspects of the problem, whether it's an infection, an allergy, or something else entirely. And it highlights the importance of being open and honest with your doctor about your symptoms and any potential triggers you might have noticed.
The more information you provide, the better equipped they'll be to get to the root of the problem. It's a team effort.
Yeah.
You and your doctor working together to get you back to feeling your best.
And this deep dive's made me realize something important. We need to normalize conversations about vaginal health. For too long, these topics have been shrouded in secrecy and shame,
Right.
preventing people from getting the information and care they deserve.
I couldn't agree more. It's time to break down those barriers and create a culture where everyone feels comfortable discussing their bodies and advocating for their health.
It's about empowering yourself with knowledge and feeling confident in seeking the care you need. So, to our listeners, if you're experiencing vulvar itching, remember, you're not alone. This is a common issue, and there's absolutely no shame in talking about it or seeking help.
And it's important to remember that taking care of your vaginal health is an ongoing process. It's not just about seeking treatment when something goes wrong. It's also about making healthy choices every day.
Exactly. Those simple prevention tips we discussed earlier, gentle cleansing, breathable fabrics, no douching, they're not just about preventing itching, they're about promoting overall vaginal health and well-being.
Your vaginal health is an integral part of your overall health, and it deserves your attention and care.
And on that empowering note, we'll wrap up this deep dive into the world of vulvar itching. We hope you learned something new today and feel inspired to take charge of your own well-being.
Remember, knowledge is power.
Yes.
And when it comes to your body, you deserve to be empowered.
Stay curious, stay informed, and keep those conversations about vaginal health going. Until next time, take care.